Hello. This video will show you how to do a medication reconciliation in both outpatient and inpatient scenarios so that it meets national patient safety standards. Before we demonstrate how to do a MedRec for an outpatient and an inpatient, it is important to cover the 5 steps that make up the National Patient Safety Goal number 3, which defines what is necessary to constitute a valid MedRec process. Patient Safety Goal number 3 has 5 elements of performance, or EPs, associated with it. Missing any one of the EPs would constitute a failure during a Joint Commission audit. Essentially, all of these EPs can be simplified into the following process. First, print the patient's medication list. Then, have them review it and make any changes to it. Have a staff member go over it with them to verify their changes, and then enter them into their medical record. Give the list to the provider for verification and to add any new meds to the list. The provider then discusses with the patient the importance of managing their meds and gives them the corrected list of medications to take with them. The provider then documents that they did the reconciliation in the patient's electronic medical record. Now that you know the official requirements, we will demonstrate the outpatient process using AHLTA and then the inpatient process using Centris. These processes cover every EP and if followed will pass any Joint Commission audit. For an outpatient visit, the staff begins by printing the Admission Medication Reconciliation Worksheet, or AMRW, and then gives it to the patient to review and verify. Please instruct the patient to make any changes, additions, or deletions to their prescription medications, over-the-counter drugs, vitamins and herbal supplements, and any medications they may have received from a provider in the host nation. Outpatient primary care clinics utilizing the T-SWIFT AIM form in AHLTA will use the Exit CCP tab to document the MedRec. This screenshot shows the 2 options that are available. The option on the left should be selected to document that the medication list was reviewed with the patient and the reconciliation completed. The option on the right is different in that it also documents the phrase, "List given to patient." This is only selected when the list was physically given to the patient. Within the T-SWIFT form, there is a section titled Current Meds. This is a free text field where you can record current medications. This list is verified against the AMRW list and updated accordingly. Outpatient clinics not utilizing the T-SWIFT form can document the medication reconciliation in the Disposition section of the encounter. As shown here, the comment box is where the provider should use the statement, "Medication list was reviewed with patient understanding, reconciled, and list given to patient." To make this part of the process faster, it is recommended to use As You Type software. If you need help, contact your clinical systems trainer. To add both OTC and outside medications, open a patient chart in AHLTA, then select the Meds module in the folder list on the left of the screen. Then, when the module appears, on the action bar of the Meds module, you can add, discontinue, modify, renew, or print the patient's medications. In this example, we are adding an over-the-counter medication, a multivitamin taken orally once a day. From the AHLTA action bar, select Add. A new window titled Select Type of New Medication will appear. When it does, select the button Record OTC Outside Medication. When the data entry form appears, select the Medication button. A new window titled Healthcare Data Dictionary Search will appear. At this point, choose either Coded Entry or Non-Coded Free Text. For a coded entry, type the med name into the text box and click the Search button. Then select the appropriate medication from the directory and hit OK. For a non-coded free text entry, simply type the med name into the text box and then hit the OK button. When the data entry form appears, record the following information: the directions for taking the medications, the name of the ordering provider. If the provider is unknown, enter unknown. If it was purchased by the patient, then type patient. The date as listed on the prescription. If it was purchased, then type the date the patient began taking the medication. The expiration date as listed on the prescription. If it was purchased, then enter a date 1 year from the order's start date. Type any relevant comments and press OK to submit the information. It is recommended that you hit refresh to verify it was properly added to the med list. It is important to remember that all new medications prescribed during the encounter must be written in the AMRW in layman's terms, to include the medication name, the dosage, route, frequency, and purpose. This concludes the instructions for doing a medication reconciliation in an outpatient environment. Before we discuss the basics of doing an inpatient medrec, it is important to mention a couple of important points that affect how they are done differently in a same-day surgery situation versus a direct admission. When a patient is admitted directly from a clinic or the ER as an inpatient, a chart is created in Accentris and all of their meds are automatically sent over from CHCS to populate their Accentris record. So in this case, the medrec is simply a normal verification and update process within Accentris. In a same-day surgery situation, the provider normally creates a record in Accentris when they schedule the procedure, which may be up to 30 days out. At that time, they do not normally do a medrec, but instead it will be done on the day of the procedure. Since they are not being admitted at that time, their medications are not automatically updated from CHCS, so the provider or nurse will need to do the medrec in Accentris by typing it in directly to the record. There are other important points concerning allergies, discharge summary types, and so on, but for the purposes of this video, we will only cover the most basic and generic medrec process for an inpatient using Accentris. For more detailed policies and procedures, please see your clinic chief for the SOPs. Once you've opened up Accentris and found the patient's record, open up their note list, and if there is not already a medrec note that has been started, click on New Note on the far left of the icon bar to select a note type to create. When the Select Note Type window appears, do a search for Medication Reconciliation. Select a new medrec form that is designated by the asterisk, and then hit OK. Please note that using this form will auto-populate your HP, the nursing assessment, and the discharge summary. When the medrec worksheet appears, fill out the patient information as indicated. Please note that even though there may be allergies listed in the next section, these have been auto-populated from CHCS and AHLTA, but are only for display purposes and are not data that is readable by Accentris. Therefore, it is important to add all of the listed allergies and any others that the patient mentions so that Accentris can create and display any drug allergy alerts. In the next section below allergies, check the appropriate box as to whether the patient is taking any over-the-counter medications, herbal or dietary supplements, or meds prescribed from a local provider. The next section down will have any meds that have been entered into CHCS or AHLTA. It is then up to the provider or attending caregiver to ask the patient to verify the list. When the box is clicked, it confirms that they are currently taking the med. Not clicking the box automatically documents that it is not currently being taken. The dosing instructions can be entered by anyone, but only the provider can enter data into the inpatient plan field. Remember that if they are a same-day surgery patient, that CHCS or AHLTA will not have auto-populated any of the fields. Therefore, in those cases, all of the meds will need to be entered manually in the next section. If any medications do not auto-populate, or the patient is taking medications not listed, such as over-the-counter meds, herbal or dietary supplements, and so on, then they will need to be entered into the section further down labeled as Additional Medications. This section allows the user to either choose from a drop-down menu of formulary drugs or to simply type the name into the field. The rest of the boxes and fields still need to be filled in as required. When completed, the medrec form must then be signed at the bottom as indicated. Upon discharge, make sure to use the appropriate type of discharge summary. This may be the multi-D summary or a standard discharge summary, depending on the nature of their admission and the length of stay. Please follow your clinic SOP for these requirements. Under the medication section of the discharge summary, all pre-admission medications that were marked as currently taking will auto-populate. Indicate your discharge plan for these medications and write the dosing instructions, route, frequency, and purpose in layman's terms. For all new medications, check the New Medication box and fill in the form appropriately to include the same information. It is important to remember that verbally counseling the patient about their medications upon discharge is required to meet patient safety standards for medication reconciliation. And finally, Please note that a MedRec must be done upon any transfer to a different level of care. Please see current directives for details. This concludes the demonstration on how to do outpatient and inpatient medication reconciliations. To receive credit for viewing this training video, please click on the link below to send a confirmation email to the LRMC Patient Safety Office. Thank you.